And trying to figure out what order to go in. I guess we'll start with you, Trish. Here closest to me is Trish Hussey, and she is the Executive Director of Freedom House Recovery Center. For 40 years, Freedom House has provided services to help people with addiction, mental illness, and developmental disability. They provide residential crisis services, outpatient substance abuse and mental health services, transitional living, and extended care. Then we have Lamar Proctor, Jr., who is the Senior Assistant Orange County District Attorney. Mr. Proctor has been with the Orange County District 15B District Attorney's Office since 2004. Prior to coming to North Carolina, Mr. Proctor served as the Assistant District Attorney in Brooklyn, New York. He has an extensive experience as a prosecutor from these two roles, including work in homicides, domestic violence, and property crimes. Mr. Proctor has served on the Governor's Crime Control Commission and as an instructor for family violence prevention in Orange County. He's the past president of the Orange County Bar Association in 2011. Next, we have Courtney Kennedy. Ms. Kennedy has been the coordinator of the Orange County Drug Treatment Court since 2003. The program provides options for families who've lost custody of children due to substance abuse and individuals who are facing jail time for substance abuse. The goal of the program is to help substance abusers get treatment and free up resources from being used in court costs and incarceration. In her role, Ms. Kennedy provides client counseling, oversees drug screening, provides summary reports to the presiding judge, and maintains community partnerships for funding and other support for the program. And then finally, we have James Williams, Jr. James Williams has been the Orange County Public Defender since 1990. Prior to serving as the public defender, he worked in the Mecklenburg County Public Defender's Office and in private practice. He's a graduate of Duke, both undergrad and law school. Mr. Williams has served on a variety of professional boards and commissions, including on the North Carolina Commission on Racial Disparity in the Justice System, as president of the North Carolina Public Defender Association, and on the North Carolina Advocates for Justice Task Force on Racial and Ethnic Bias in the Legal System. So please join me in welcoming our panel this evening. So what we wanted to do was start off with a 5-minute kind of here's what I think from each of our panelists, focusing on expanding drug treatment options in the legal system and in the community, exploring alternatives to incarceration and drug use as a public health issue, and strengthening public health's role as a model for policies and practices to decrease drug misuse, abuse, and overdose in Orange County. And one of my favorite lines from a movie is, tell it to me like I'm a 5th grader, because this is new information for a lot of us. So I don't know if y'all want to do rock, paper, scissors to decide who's going to start us off, or if you want to just go linearly.
I think we should go in the order that you introduced.
Okay. Would you like to terribly fair? You would give us a start? That would be wonderful. So you and I would share this microphone. Is that right?
That's good. So I forgot to send my bio in, so you can tell it was very, very lame. But
feel free to add anything that you would like.
I was a legislative liaison with the Alcohol Drug Council of North Carolina before I came to Freedom House for 14 years. And at that point in time, I was thinking tonight, as I was going over some of the press that I've been reading for the last 2 or 3 weeks, that Tony Mulvihill, who was the director of the Alcohol Drug Council for many, many years, and who was either revered or despised by many people in the state because he was very outspoken, and clearly he was such an advocate for people who were dealing with alcohol and drug addiction before anything else. But Tony would often have a backroom conversation with lots of people about whether marijuana should be legalized or not, and how he felt like it would cut a lot of the criminal justice issues that we see, people that get caught up in that down. I'm not really sure where I stand with that at this point, but I will say that at Freedom House, of course, our commitment is to treatment of people and spinning them out of the kind of centrifugal force that they get into for a variety of reasons. One of the things that wasn't in my bio that I didn't send, because I didn't send a bio, is I have a Native American grandmother, and I was one of the first members of the Adult Children of Alcoholics Board in the state of North Carolina. And so I grew up with this, and it's probably why I ended up in this field. But watching, I mean, my dad happened to be a very successful alcoholic, but he was on the town council and all that stuff. But it really did keynote his entire life. It was at the center of everything that happened in our family's life. It's such a family disease. And watching what happens when people don't have the support or the treatment and the community support they need early on as they become involved in either heavy drinking or in drug use is really a ravaging sort of disease in our community. And to watch people end up in the criminal justice system when they have many other assets going on in their life has been really difficult too. We have a lot of people that come through our programs at Freedom House, and Courtney and I have worked together with Drug Treatment Court for many, many years, as have many wonderful people in this community and our CIT officers. And it's been difficult to watch people who have a slip. I mean, these are diseases that are noted for their relapse. But having such a punitive approach to the way that we look at addiction instead of being treatment-oriented has really turned, it's meant that lots of people that could have been successful end up heading down a path where their lives are really kind of torn apart. And it's very difficult for them to get up, get moving, and break out of it when they have so many strikes against them. So I was really delighted to hear some of the pronouncements that have come out in the last few weeks with Eric Holder looking to cut mandatory minimum drug sentences, looking at having more of a fair and impartial approach to matching punishment to the act, if you will. And I've seen many of the people that have come through our treatment programs, and Joyce is sitting back there. I don't want to speak for her, but she may agree to this, and Courtney probably certainly would, as many of you might. But we see people that are really young people that are caught in a pattern of abuse that end up being penalized in ways that people who have much stronger charges, crimes, are getting. The 3 strikes rule has been one that has been very difficult, I think, for many people who are dealing with addiction. So having a not such a draconian approach to the way we look at that, and having just a breath of fresh air come into the way that we look at how we're going to be treating people in the court system, having a more open sense of the way that treatment can impact the problems that we have in our communities has been really refreshing. We have been involved with the CIT officers, and I really want to commend our law enforcement officers. They have embraced, as they have learned more and more about the diseases of mental health and addiction, they have embraced a new way of doing business in the community, and it has been amazing to see. As has our court systems. We're lucky to be living in Orange County. We also work in Durham County, and I would say that we're lucky to be doing business in Durham, but way more so in Orange County. So I think our county really has looked at a lot of the issues that the whole country is looking at in ways that they're just catching up to at this point. So I'm going to pass this on.
All right.
Yeah.
So my name is Lamar Proctor. I'm the Senior Assistant DA here in Orange County. So I work for Jim Woodall, who's the District Attorney for 15B, which covers Orange and Chatham counties. So I'm going to speak mainly from an Orange County perspective because that's where I work. In the past 14 years, I've seen the criminal justice system sort of move towards and embrace alternative sentencing for all levels of crimes, especially low-level property crimes and drug crimes, and because it's cheaper, it's better, it prevents recidivism, it reduces recidivism. There are occasionally crimes that are of such level, or the defendant has such a prior history that there's no choice but prison as per the North Carolina legislature according to the laws of North Carolina. So if you commit an armed robbery, then you have to go to prison. But there's a whole bunch of crimes. Most criminal activity falls in what we call an intermediate block, which is where the judge is allowed to give probation, and that's where treatment comes in. There are treatment options for people who go to prison, but they're few and far between, and they tend to wax and wane with the legislature as they fund and defund programs in the North Carolina Department of Adult Corrections. But our focus, I think, is people in this community who get put on probation who are not sent to the Department of Adult Corrections. And that's where our office has really tried to find treatment for those we can give treatment to. There are occasionally cases where a defendant is engaged in such behaviors and continues to reoffend despite our best efforts that we just have to insist on active time. But if we can get them into treatment, we definitely try to do that. And I think that goes back to Tricia's statement that lucky to work in Orange County because it has been a progressive county in that regard. I was originally hired by Carl Fox, who's now the chief resident Superior Court judge. He embraced that idea. Jim Woodall embraces that idea, and I'm glad to work in an office that does that. So in terms of my role, I'll get a case, someone will be arrested. Usually you can look at someone's record and you can immediately tell, there was a substance abuse issue, there's a mental health issue, and then we call up Joyce Kuhn, who's back here from Alternative Sentencing, or I ask the defense attorney, please call Joyce or get treatment involved, or call Courtney, who's the drug court coordinator, and let's see what treatment options are available, because I don't want to just put somebody on probation and not specifically address their issues if we're going to go that route. Also, I want to know what we can do to help this person. I mean, it's our job as prosecutors to help the community. It doesn't help the community to send somebody to Department of Adult Corrections for 6 to 8 months, have them come back with the same issues that they left with. It's much more beneficial for them to be on probation for 2 years, to be put into treatment. And there is a certain amount of coercion in treatment that I think we'll all get to as we discuss this. Clearly, people who recognize their addiction and their substance abuse issues, or get there through different routes other than the criminal justice system, that's not what we're dealing with. We're dealing with people who, because of their criminal behavior, because of their breaking the laws, that we're going to order them to do treatment. And many of them are ready for it, and many of them are not. So our role is to identify that, to prosecute the case, to make sure that they get that there's evidence to support a conviction, that there's actually a case there. If it's a really weak case or something and we just dismiss it, then that's the end of it. But if there's a crime to prosecute, then that's our job. And we remain open and recognize that treatment is going to be much better in the long term than just short periods of incarceration. So I think that's pretty much a district attorney's office's role in that. And I'll turn it over to Courtney at that point.
I'll use the ruler. Hello, is it on?
It doesn't sound like it.
Can everyone hear me? The red light is on.
We'll check it out.
Should be a green light? I don't know.
But, so it's on, I'll just turn the volume up.
Or you can just project.
I can. Can everybody hear me? Okay, so I usually don't need a microphone, and it stands true tonight. Hello, everyone. My name is Courtney Kennedy. I'm the coordinator for drug treatment courts for Orange County. I've been the coordinator since 2003. Orange County drug treatment courts began in 2002. Drug treatment court is the program that's designed to help offenders get on the path to recovery. And it's different from a regular court session in that in a regular court session when we have the PD and the AD and the district attorney kind of on opposite ends, drug treatment court is there to provide a team approach where we have the public defender's office and the district attorney's office and treatment providers on board and the judge. We all get together to try to develop a plan for offenders. Drug treatment court kind of takes a holistic approach to recovery in that we not only focus on someone just remaining substance free, but we also look at mental health issues, employment issues, family issues, things that may drive someone to use. And what we found is that most of our folks are dual diagnosed, meaning they have both mental health as well as substance abuse issues, and a lot of them tend to self-medicate mental health issues by using drugs or alcohol. So we find that out and we try to treat them as best we can. As far as exploring alternatives to incarceration and drug use as a public health issue, I think that we've worked really well with the public defender's office and district attorney's office over the years to try to use drug treatment court as an alternative to incarceration. And we also collaborate with Freedom House, who's a primary treatment provider, as well as UNC Horizons, which is a gender-specific treatment provider for women. And both treatment providers have been excellent as far as providing service for our clients. And we also use UNC ASAP as well. But treatment in Orange County is sparse. We have pretty much 3 treatment providers. There's not a lot of residential treatment locally, so we do tend to have to look at residential facilities outside. Freedom House has been great as far as providing a men's halfway house and a women's halfway house, and it tends to always remain full because of the need out in the community. So that has been difficult as far for us throughout the years, trying to figure out how we can serve the population that we need to manage. So drug treatment court is an alternative. TASK is an alternative, and TASK has been a great service as far as reaching out and providing a referral service for offenders that need substance abuse services that may not meet the level for drug treatment court. Drug treatment court is a program that's designed for high-risk, high-need individuals that require a lot of resources. We did used to have a health department representative on our drug treatment court team, and hopefully we can get back to that type of collaboration in the future. Drug treatment court is about using community resources that are available to provide the services for our clients. So we're always trying to see exactly what is out there, how we can connect with them to provide the appropriate level of service for our participants. And I will pass the ruler.
Non-working mic.
It should be.
Okay, my name is James Williams. I am public defender for Orange and Chatham counties. First of all, I want to thank the department for staging this event. One of the things that the Attorney General stated in his speech was that he wanted to open a frank and constructive dialogue about the need to reform a broken system, to fight for sweeping systemic changes we need. And that's what, at least we're beginning that discussion today. And a lot of places, throughout this country, they're not having this discussion right now. There's some places that they are. And so I appreciate the fact that you are beginning this discussion here in Orange County. Part of the problem, I think the major problem, and we'll not going to dwell on this, and we may get back to it later in the evening, is that in this country, we've decided to deal with what is a public health problem by criminalizing behavior that should be treated within the public health system. The primary focus for the past 35, 40 years in addressing drug abuse and addiction has been through the criminal justice system. And one of the things that's happening now is that you are beginning to have people question that, and why? What do you have to show for 40 years of punitive criminalization of people using and abusing drugs? Nothing but a lot of ruined lives, a lot of damaged communities, and the problem still continues. And I think that's part of what the Attorney General is trying to get at. We need to look at what we're doing, keep that that's working, and reevaluate what's not working. One of the things that Courtney mentioned, I think, that is critical. I mean, we have treatment services, but we don't have enough, particularly for indigent people. Most of the people coming through the criminal justice system are indigent. So they don't have access. They can't go to these private treatment facilities that may be available either in this area or in other places and just, put up their health insurance and get treatment. So, and there's not enough. There's not enough services available. Even I think I'm told by I was told by my staff that there's only one task person on staff now. So those people that need to be evaluated, and so there's one person doing all that, which used to be more than that. So resources are, when you talk about what's the problem here, resources, and I don't have an answer about where you can get more resources, but part of the difficulty in terms of addressing people's addiction needs is that we don't have sufficient resources for the people who don't have money. I mean, Freedom House does a great job, and they're tasked with the resources that it has. It does well, but we could use, and there's some other programs that help, but we could use more to really address the addiction issue. And even in the operation of the systems that we have, part of what's happening is that when you're dealing with, so it's not just a question of treatment. When you're dealing with the population that has already been criminalized, you've lessened their opportunities to succeed in life. And so I think there's room for bodies like this Board of Health to make recommendations to the criminal justice system. The thing about systems like the criminal justice system, sometimes you get sort of stuck in your old way of doing things. You used to doing it a certain way, and so you just continue because that's what you're used to. And so one of the things that I hope to see more of, bodies like the Department of Health, other entities in the county and in the state of North Carolina saying to the criminal justice system players, including myself, including Mr. Woodall, including drug court players, including law enforcement, let's reevaluate this whole system and let's see what we can do that's going to actually help people more than harm people. There are a lot of people who are coming into this system unnecessarily being harmed. And so we need to start thinking about what steps we can do, what changes we can make that's going to more ensure that people are going to succeed. Because if they succeed, then we succeed, because we are all better off when people are able to do things like find a job, find a place to stay, get access to benefits. And what's happening when you're channeling people through the criminal justice system and giving them conviction for a lot of, small either possessions or transactions of small amounts of drugs, is that you are diminishing the chance of those people to be successful in life. And one of the things I want to point out also, we'll talk about this later too, is that people of color are bearing the brunt of this unjust war on drugs. And that's another reason that we need to reevaluate how we're dealing with this problem. I don't know if there's 5 minutes from now.
Perfect, thank you. So do I need to present? They're not. Do I have to?
That's a Stacy question.
Stacy gave me a look, I need to. Okay, also Stacy gave me a reminder that I forgot, so I'm gonna remember to do it now, slightly late. We are tweeting during this event. I say that because I'm not really sure what that means. But it is hashtag OCBOH, correct? So if you are a tweeter and are interested in following the dialogue that is occurring on Twitter, that is how you can do that. We will also be soliciting questions via Twitter. So at some point, if I forget, remind me, I need to ask Stacy if we've had any questions from Twitter. So, talking about questions, what we very much like to do is open this up for just a conversation. So I don't know if there are any Board of Health members who have questions that they are dying to ask. If you're on that side of the room, you don't have to use a microphone. If you're on this side of the room, you do. So, Liz, it looks like you have one.
I did. I'm very involved with the Women's Shelter Clinic, Project Home Start, and know how many of the clients there are involved with your program. And as we were saying, there's not enough programs for everyone. How do you decide which people are able to get in for treatment?
We keep expanding as much as we can. Of course, we can't do that with licensed programs, licensed beds, because you have the number of beds that you're licensed to have. But with our detox center and our outpatient program, and a program that we just started in conversation with staff from Home Start, we started a SACOT program because there were women who needed to be in the house and avail themselves of the good services there that really were having some difficult behavior issues because of their addiction issues. So in talking together, we started a SACOT program, which is a substance abuse comprehensive outpatient treatment program. And it's a day program that women would be in Monday through Friday for 4 or 5 hours a day. And that's evidently helping. So there are ways to be creative, I think, in the community when you're looking at capacity. This is, we need to be having more conversations like this in our community. And we're all busy, and sometimes it's hard to make this happen. But we didn't have any more women's halfway house beds. We are usually full all the time in our 12 beds. So this has been a godsend to be able to have that conversation and expand services in that way. The other thing we've done, we served over 10,000 people last year, and we're taking in as many people as we can. And usually it's first come, first served, because most of the people that come to us are in such huge need. You do try to triage. I mean, if 3 people show up at your door at the same time, and one is homeless or doesn't have any place to live, when they get to you, then you're probably going to look at putting them into one of the halfway house beds and trying to put the other 2 people into either a detox for a short term and then roll them into the outpatient treatment programs or our intensive outpatient services. It's a real juggling act, frankly, and we do need more programming. It's amazing how somehow it's worked in the crisis and detox center. People come, we have some observation chairs that people can be in for 23 hours, giving us time to meet their need. And usually what happens is another person is just charging, and we can then admit them. come to us, to the Crisis and Detox Center, when they are living out in one of our numbers of encampments in the woods nearby, and they'll have a fear reaction. They're afraid they're going to die, that they've stepped over the line. 64% increase in prescription drug use in the last 40 years in our state and in our country. So we're getting a lot of people that, or they get sick, or it gets too cold and they're coming in. The state doesn't see homelessness as a reason to be admitted to a detox or crisis unit. But being homeless, losing your job or not being able to get a job, losing your family, there's so many indicators that will cause somebody to relapse, and just they're doing well, they have a certain, it's a disease of loss, they have a certain amount of loss, and they fall off the cliff again, and you have to pick them up. The same is true, I think, of people that just they push the envelope a little too far, and they get involved in the criminal justice system, and then they have a hard time finding a job, and they can't support themselves and their families, and it just kind of rolls downhill from there. So yeah, we're doing the best we can to take people in, and we do triage people, and when we see that there's a need in the community that we can meet, we do that too. So, but you can only expand so far of oxygen. So, yeah.
Thanks.
I want to follow up on your question of resources. Our role as a board is to advocate within the county for resources to be allocated, as well as that strategic direction for the health department. In terms of resources, where do you feel they're most needed? Do you think it's inpatient resources, outpatient treatment resources, or navigators trying to get people to the right place?
I think you might be.
I'll be really brief. Believe it or not.
And I'm not address that too.
Yeah, we have such a lack of residential, well, there aren't residential services for adolescents, and that's up to 20 years of age in the mental health system, by the way. And there's no place for them to go. Practically, there are only a few treatment services in this whole state that will take kids. There are not many psychiatrists that feel like that feel comfortable seeing young people. We're in a box. One of the things I'd love to do before I go off on the ice floe is to see us somehow have a conversation all together in our area and start an adolescent treatment center here. There's very little inpatient residential treatment in the state. That kind of went by the wayside probably 18 years ago because the state and Medicaid stopped paying for it, and so did private insurance. So, the 28-day treatment programs, not that that's a magic number, but it was what we had. There's practically none of that anymore, and you have to have a lot of money to find one. So halfway houses, we've kind of pasted together that service by having people in longer-term residential, like in a halfway house setting, and coupling it with outpatient services. So we've got them in a setting where we're giving them a lot more than they would get just in a normal halfway house setting, and that works for some people.
Yeah, I would just add, we need it all. We definitely need more referral services, more case managers, if you will, who could develop a treatment plan. What I think would be very beneficial is if there was because we do have some of that with alternative sentencing and with drug court, there will be a development of a plan for a particular individual, but there are a lot of individuals who are very low-level offenders, who don't have much of a record, who it's just like, okay, probation. Well, there was something that brought them here, and it would be just great, and you can't send everybody, like Courtney was saying, it's really high-risk individuals go to drug court, lower go to task. You got in treatment alternatives to street crime, and so you have one individual who's kind of like drug education school, go do some classes, but there's a whole spectrum of people, especially in mental health. I mean, we are really lacking in the mental health department, especially for adolescents, young people, and homelessness too. We have what's called a community resource court, where we deal with and try and help people who have mental health issues, and then we have an outreach court for people who are homeless, and it's really bare bones. It's for really low-level offenses. But if we have referral services, if we could say, as part of your probation or as part of any disposition of the case, you're going to go to the health department and you're going to do whatever intake program there was and refer to further services, and you comply with that and you do that, then you achieve a positive disposition in your case, whether it's, you know, a dismissal or a lower sentence or anything that we can dream up if we can do it. So I think that's kind of the needs that I see in the criminal justice system.
What I see working in drug treatment court is definitely a need for more local residential services, maybe 6 months to a year programs for men as well as for women. And also what we found in our family drug treatment court, there are a lot of men who are involved with DSS, but there's no it would be good for them to have a residential facility for them to be with their children, where there is one for females, but it would be good to have some limited beds for men to go with their children because there just isn't any. Also, that there's a need for therapy. You know, a lot of our folks have experienced a lot of trauma in their lives where they need to have some therapy on a regular weekly basis, whether it's grief counseling, whether it's therapy due to sexual or physical trauma that they've experienced. We found that if there was an outlet for someone to see someone on a consistent basis, then that would just be great. It's just not available locally for our population. Freedom House does some of that, but it would be great to have more resources available.
And I just want to sort of emphasize because a lot of the people that we encounter are people whose lives have been broken or who have suffered trauma, who have been through sort of very difficult experiences, and people are using these substances to try to give them some reprieve from that pain that they're suffering. But if you don't deal with that underlying issue in some fashion, then it's going to be sort of a repeating pattern. And so, it is difficult to get sort of sustained, I want to use the term meaningful, sort of the treatment at the level that's really going to make a difference in a lot of our clients' lives. And that's a resource issue.
Are there any programs currently being run within the U.S. or even in other countries? How do they handle these types of issues?
That's a great question. Well, it runs the spectrum. I mean, when you say these types of issues, I guess you're talking about sort of drug abuse and how they, and people with addiction issues, and how do they?
Yeah, does Great Britain stand up? How do they deal with it?
Well,
the same type of system.
Yeah, no, they are. None of them, I believe, and not in the sort of in the Western world, are as punitive as our system. But you have some. They go. Portugal basically has decriminalized, possessions of practically any types of drugs, unless it's a huge amount. And that's been for the past, 10 years or so. So that's one model. I mean, that's that country. I think the Netherlands has done, probably not going quite as far as Portugal, but they have gone down that path also. And then, you have, within the, of course, that certain states have moved toward decriminalization of marijuana. And that's another thing I want to mention that I think is worth noting, that on August 29th, after the Attorney General gave his speech to the American Bar Association, and after he issued his guidance to the U.S. attorneys about how to use more discretion in making decisions about whether to charge people. First of all, to charge people in federal court, but also to whether to ask for enhancements that would sort of kick in those mandatory minimums. But he also, on August 29th, he basically said to those states that had decriminalized marijuana, in Colorado and a couple of others, that we being the federal government, are not going to sort of intercede in what you are doing, as long as you carefully monitor and have some good sort of administrative protocols in place to carry out this decriminalization effort. And I think that's a major step, because I think what it says, it sends a signal to other jurisdictions. And when I say jurisdictions, I'm not just talking about states, I'm talking about counties, I'm talking about law enforcement agencies, I'm talking about prosecutor offices. That is an option. That is an option that you can use in trying to help fix this system. One thing that most people don't realize is that the vast majority of the increase in drug prosecutions in this country over the past 10 years have been marijuana prosecutions. People ending up with criminal records for marijuana possession. 80% of the cases are possession of marijuana. And here again, you have these extreme racial disparities in how these cases are, how law enforcement targets people and how these cases are handled and end up in court. And so, even in the state of North Carolina, I think North Carolina, the study that the ACLU did, they just issued their report, I guess, in June of this year. North Carolina was the 10th highest state in the nation as it relates to marijuana prosecutions. So we see a lot of them. And so the other thing to keep in mind is that 55% of the public in the most recent poll says they're okay with decriminalization of marijuana. So it's up to the bureaucrats and the politicians to decide that now is the time. What we're doing isn't working. What you're doing is decreasing the use of marijuana. People are using marijuana, and they're going to continue to. But what we're doing is ruining a whole lot of people's lives. People ended up with criminal records. I think if decriminalization is an option, one of the things that's happening in, for instance, Seattle, they have what they call LEADS program, Law Enforcement Assisted Diversion. I don't know if it's throughout the whole city, but in 2 of their major inner city areas, what they have decided to do is people who are engaged in certain behavior, whether it's possession of drugs or sales of small amounts of drugs, I think prostitution is included in this also. Instead of those people being funneled through the criminal justice system, the law enforcement tickets them, but basically funnels them toward resources, whether it be mental health, whether it be drug treatment, whether it be trying to get them housing assistance, or whatever the case may be, rather than getting the criminal justice system involved in the first place. And so that's an option. That right now is sort of a pilot project. They've been doing it now for like 2 years. Once they go through another year or so, they're going to issue sort of a report on how it works out. So there are a number of things that can be considered. But those are some, like I think in several states over the past year or so, they have not gone to a strict decriminalization of marijuana, but they have, for small amounts, they have opted not to include it as to make it a chargeable offense, or they have scaled back what the possible penalties were for. I think Texas, which is usually considered one of the most punitive states in the nation, they've gone down that path, and a few others over the past couple of years.
Just as a follow-up, I went to Seattle for the first time. Just like the past summer.
Is that right?
And I didn't realize that at that moment.
Yeah.
When we were walking through the park.
Yeah.
And so.
And I'll add to that, just my experience was when I was at the Brooklyn DA's office in New York City. I was 99 to 2004, so it was about 9 years ago. But even back then, we had an misdemeanor treatment part, we had a felony treatment part, there was a case manager who was assigned to the courtroom, who was kind of the liaison between the treatment providers, who would give the information to their office. They would input that in the computer. The defense attorney had it on their screen, the prosecutors had it on their screen, and everyone could look and see the last positive drug screen, how they were doing in treatment, what level of treatment they had. It was just incredible resources that North Carolina's not even close to that. It's not a priority for the legislature. It should be, it needs to be, because it works. It prevents recidivism. And in New York, if a criminal defendant successfully completed drug court or mental health court, their case was dismissed. I mean, that was it. I mean, that charge went away. I mean, many people in those courts had a prior list of convictions, but that charge went away. And, you know, we should work towards that as well. But it's difficult with limited resources because you're trying to target the people who are the highest risk. But when you have an entire court part dedicated every day to addressing mental health and substance abuse concerns, you can get a lot done. But we just don't have that sort of resource. I think, you know, once again, I think from the health department's perspective, if there was just an entry program or just an assessment sort of thing that we could refer defendants to, I think that would be a huge, huge thing for Orange County.
That was a nice setup for the question I had. Ms. Kennedy mentioned that there used to be somebody from the Department of Public Health there in the drug court. What was their role? Why aren't they there now? And that's probably something that needs to be on the record because the board needs to consider whether that's well worth the investment. If there's something we can do.
Well, initially, we did start out with the health department representative, and I think the reason that was given to us when that person could no longer sit on the team was probably lack of resources on the health department. Maybe they were needed somewhere else. But also, I think that on our end, we really, this was towards the beginning, so we really didn't establish what their need was for our program at that time. So what we're finding now, and something that I target when I talk to the clients now is, you know, when was your last physical? Because that's important. To know exactly if there's any type of physical health issues that can be addressed. I'm not sure exactly how the health, and more conversation needs to be had about what type of services the health department provides now, especially regarding men. I know that there's a lot of services for females, but I think that a conversation does need to happen again as far as how the health department can play a role as far as drug treatment court is concerned, how we can better collaborate. Because physical health as well as mental health is very important for our population.
Sounds like there probably is a need for a pilot where both social services and Orange County Public Health had an opportunity to demonstrate some results during the pilot time period.
Definitely, we need to have a conversation.
Back in 1983, I was in graduate school in the mountains of North Carolina. And one of the things that I somehow ended up being involved in was a community conversation that ended up in running a grant and getting funded for it. And it was the most amazing community effort. A bunch of graduate students and some other folks in the community taught the school system into letting us use the schools after hours out in even at that point in time, there were some real backwoods areas where people never got out, and they were so cut off. But we would go into the schools. Public health was a leader in that effort. They would send their nurses and their docs and other healthcare providers out to immunize children, to help mothers who weren't receiving any sort of prenatal care, to look at that point in time, drug addiction and a lot of alcoholism. The community colleges came out, the university kicked in, lots of students came out to provide tutoring for the kids, but families would come. This didn't even cost that much. I mean, but families would come to these schools, they would be fed dinner, and their kids would be taken care of while they went to both rehab, who also came out in the evenings, and these are people that likely wouldn't have been able to even get into town to see all of these wonderful community supports. And it really made a huge difference. During the 3 years that that program was funded, the dropout rate, a lot of kids were dropping out in 5th grade to work with their families and their stills and all. This was in really back in the mountain areas around Boone. And the rate of staying in school, not dropping out was, I can't remember the figure, but it was astronomical. I mean, kids were staying and completing high school. They were seeing some things that they had never seen before. And I think that we have, of course, a different culture here altogether, but I think the big point was looking at the way that different entities in the community had started having a conversation about how they could come together in a different sort of way to provide services that weren't so siloed, because we do have a lot of gifts in our community. I think we're just not finding the time or realizing how beneficial it can be to have the kinds of conversations that we're having here. So we're dependent at Freedom House on public health to help a lot of our folks. A lot of our folks have diabetes because they've been using for years and years and years. Whenever they have a health event, it's a trigger to relapse. We've gotten a grant from KB Reynolds to integrate a healthcare clinic on our campus in Chapel Hill, because we have so many people that aren't going to get the care they need for heart disease, diabetes. They'll get major infections because they will have an eye fight. Nobody's caring for the wound. They'll have women that are pregnant that never seek the kind of care that they need during their pregnancy because they don't have health insurance. Hardly anybody with a substance abuse addiction disease is going to be eligible for Medicaid unless you're a mom that has some kids and still has those kids. So we see a lot of health needs, and that's a great point to bring up, Courtney, that are going unmet. And when people feel like they're up against a wall at the end of the canyon, the thing that they run towards is starting to use again. They self-medicate. Things are too painful. Their lives are falling apart. I think that the health department and lots of other entities in our community can really lead the charge and look at how we connect a lot of the dots in our community. We work with the Rape Crisis Center. They come over regularly because 82% of the women that come into our houses are either prostituting to get drugs, abused because they're in a relationship with a person that's hurting them badly. All of the stories that we know, and they need that help. They're traumatized. So we don't do that because we have experts in our community. Rape Crisis comes over and does it. We work with a lot of different, the Literacy Council comes over and sends volunteers to help a lot of our folks who don't have a high school diploma. While we've got them, attentive audience, they're there for 3 to 6 months in the residential programs. They complete their GED. It gives them an opportunity to find a job that they couldn't find previously. There's some simple things that are already in our community, but if we make those linkages in a better way, can really make a huge difference.
Do we have time for?
Yes, we have 15 more minutes.
Well, I've been struggling to try to better understand how the Board of Health and the Health Department can participate in the conversation and help advance these issues that we've been talking about. And we don't have particular interest in interjecting ourselves where we don't need to be, for example, criminal justice contribute what we do to the bigger conversations?
I think keeping this conversation going is one thing that would be helpful. We have a really big at Freedom House, we had to expand size-wise because we were running out of space to have more therapy groups and clinical groups. So, but in doing that, we also have a really big space, not as big as this, but close. It's our cafeteria, and got a sound system that somebody donated. So we have a good cook too. We'd invite you guys to come over and hear from the people that are in treatment there. Many of them are incredibly articulate and would be happy to tell their story. I'm always really moved when they do that because it really gives the kind of picture that I think helps us all know where we can begin in the community. I mean, it's hard not to make assumptions. We know what we know. That's all we know until we look deeper and find out more about the causality of how somebody ended up where they are. And it's usually a long history that makes a lot of sense when you hear it. People don't. I have a wonderful person that's been working with us for years, Courtney, you know, Annette. She's been in recovery for many, many years. We'll tell you all about it. I'm not writing her anonymity because she's a real spokesperson. But she said something to me when I first came to Freedom House that struck me. And it was such a simple statement. She said, you know, nobody wakes up one morning and just decides they're going to be addicted, that they're going to be an alcoholic or an addict. Nobody wakes up and decides that's going to be their life plan. A lot of people get there in ways that start out seeming harmless. Many people can drink in this room, and many people can't. They can't pick up that first drink. They got, we know it's a disease now. There's too much research.
Courtney, how would you answer that question? I would say in terms of if our folks, if they had, someone that they could see on a regular basis, if they had a primary care provider, then that would reduce the amount of visits to the emergency room, which, in effect, would reduce costs that's associated by the taxpayer. So, if we had a service where folks could connect with and provide and obtain the services that they need as far as their physical health, I think that could really ultimately benefit the community as a whole, and also the families involved. You have to think about these women who have these drug-addicted babies that end up having all of these other issues, whether it's ADD or some other type of behavioral issue for the children that they have to now deal with as well. So I think it's more of getting these women as well as being connected for services. And I think ultimately we wouldn't have these folks going in and out of ER rooms. Or right now what I do is I refer a lot of folks to the Shack Clinic on Wednesday when they get sick, so that they don't have to go to the ER and use those funds. So just having those services available so that folks can get that help that they need.
And I would just add, I think, I would propose some kind of a meta kind of group meeting, because just anecdotally, I think 85%, I'll just throw that number out there, of defendants who enter the criminal justice system, it comes down to mental health and substance abuse. I mean, there's cases of people who are otherwise fine, who just make a mistake or who engage in college hijinks or whatever. That's not a public health issue. People who are engaged in high-level felony, sexual assaults and armed robberies and homicide, once again, I think that's solely a criminal justice issue. But in between, which is the vast bulk of the cases we see, are really these public health issues. There's the adolescent whose parents are both drug users, or whose father or mother went to prison, who are being raised by grandparents, and there's health issues all over the place. You got, I can think of cases right now where there's, a young defendant who really never had a chance to begin with, but now who's taking care of an elderly grandmother who's got health issues and who is now at 19 years old a new father.